I can do. Seems like you ought to go to the states and you ought to say which ones are the first you're going to look at. You look at the number of the population, look at the number of the Medicaid. I'm talking about the whole population in the state, the Medicaid recipients, the amount of federal and state tax dollars being spent, or Medicaid dollars, and then the method of recovering, if any, of the fraudulent dollars.
Welcome back to Freedom Forge, where truth is forged in fire and accountability actually means something. If you believe in protecting taxpayers, defending the most vulnerable, and holding government systems accountable, go ahead and hit that like button and subscribe right now, because today's breakdown is something every American needs to hear. This Senate hearing focuses on healthcare fraud, specifically involving Medicare and Medicaid, and how billions of taxpayer dollars are being lost to scams, waste, and abuse. Lawmakers are questioning federal officials about how these fraud schemes are happening, who is responsible, and what is being done to stop them. At the center of this discussion is a disturbing reality. Programs meant to help the elderly and vulnerable are being exploited on a massive scale.
In yields, the chair now recognizes the gentleman from Texas, Mr. Weber, for his 5 minutes of questioning.
Thank you, sir. Deputy Administrator, we're glad that you're here. How long have you been in this role?
I have been in this role since January of last year.
And you were there in the Trump administration in a similar role.
This is my third tour at CMS.
Yeah. You seem very knowledgeable about this. I appreciate that. I want to talk about my own home state of Texas. And in Texas, $65 million was paid in fraudulent Medicare claims related to genetic testing that was never even requested on behalf of the beneficiaries. It seems like you're aware of that. Have you observed to their lab schemes that's involving fraudulent or unnecessary lab testing? How do you get to that? What's the process?
It's very difficult, sir, and we have observed it. In fact, as I mentioned to you with our fraud detection war room that we have, the $1.8 billion we stopped last year, $100 million plus of it was related to just those types of laboratory services. And unfortunately, what that means is then when those services get billed, even if they're not provided, they go on the patient's medical record, and it precludes them from being able to get that type of testing in the future when they might need it for a cancer diagnosis or something more serious.
So our great citizens are the brunt of that, really, while the thieves are making away with the taxpayer dollars.
Correct.
I appreciate what y'all are doing. Programs like Medicare and Medicaid are designed, as we would say, for the most vulnerable populations in our country, such as the elderly. These populations are also the most given to healthcare scams, as you well know. Given the essential role CMS plays in our healthcare system, how do you educate some of those elderly population to stay away from those scams?
It's a great question, something we are continuing to work even more on. Right now, we have several different things. We've been doing various videos that Dr. Oz has been posting, telling people if you see something, say something. Call 1-800-HHS-TIPS. Call 1-800-Medicare. Contact your senior Medicare patrol. The hospice fraud that we've been looking at in Los Angeles, a big part of how we've been able to really successfully go after it is because we are partnering with the state officials for the senior Medicare patrol and for the organizations that are protecting Medicare and Medicaid beneficiaries in LA and really using them to help us identify where this fraud is occurring and to then educate their members and the beneficiaries they serve about what to do. It's really important to us that seniors understand that they should not fall victim to these schemes or give their information out to people. It's when they do that these types of harms occur.
Well, your lips to God's ears. I appreciate you all doing it. This, just to me, I'm just a simple guy. I owned an air conditioning company business for 35 years, but math I can do. Seems like you ought to go to the states and you ought to say which ones are the first you're going to look at. You look at the number of the population, look at the number of the Medicaid. I'm talking about the whole population in the state, the Medicaid recipients, the amount of federal and state tax dollars being spent, or Medicaid dollars, and then the method of recovering, if any, of the fraudulent dollars. CMS claims by state, so identify the first state. Are you doing that? Are you giving states priority to those you have the most amount of fraud in said state? How do you do that?
It's a combination of things, as we mentioned, or as I mentioned earlier, we really do use a data-driven approach. For instance, some of our recent actions, which led to the letter to New York State, was because in New York, what we found was that their spending for Medicaid beneficiaries was 36% higher than the national average. And we were trying to get a better sense of why that is, particularly because of the fact there were several particularly fraudulent types of services, such as adult daycares, which seem to be funneling a lot of these dollars away from legitimate
Next thing you know,
services.
you'll have daycares in Minnesota that get paid millions and millions of dollars for keeping care of kids, and they don't. Did I say that out loud?
And they also have autism services where there were kickbacks of several $1,000s paid to patients or to parents for bringing their children in to claim they had autism and to seek those services, which were never provided.
So how do you, and so when you say New York was 36% higher than the other
Yeah,
states?
the average spending on each beneficiary for New York Medicaid is 36% higher than the national average.
Did they seem willing to work with you and to find out why that is? And to
Well, that is why we sent them a letter, and we are hoping to get a response so that we can better understand, using the information they provide, why that's happening. I will say with Minnesota, we've been able to come to a much better understanding of what some of the issues were that drove that spike in spending, and we're working with the state to hopefully get better program integrity safeguards.
Yeah, well, there's a lot of waste, fraud, and abuse out there, isn't it? And
There is. It's not just out and out fraud. There's also a lot of waste, people billing for services that at a higher level than necessary. There's also a lot of abuse in that people are just taking advantage and billing for things that just aren't necessary at all. And then that puts beneficiaries at harm too.
Well, thank you. Our most vulnerable Americans are paying that price, aren't they? Mr. Chairman, I yield back.
Now, let's get into what actually happened here, because this is where things start to get serious. You have a representative from Texas stepping in, asking straightforward questions about fraud in his home state. And what we hear is shocking. $65 million in fraudulent Medicare claims tied to genetic testing that was never even requested by patients. Let that sink in. Tests people didn't ask for, didn't need, and in many cases probably didn't even know about. Yet someone is billing the government and collecting money anyway. This isn't just a paperwork error. This is organized exploitation of the system. And it gets worse. We learned that over $100 million of fraud that was stopped in just 1 year was linked to similar lab testing schemes. That means this is not isolated, it's widespread. It's systemic. And here's the part that should really concern you. When these fake services are billed, they actually go onto a patient's medical record. So later, when that person genuinely needs that test, maybe for something serious like cancer, they could be denied because the system shows it was already done. Think about that. Fraud isn't just stealing money. It's putting real lives at risk. Now, the official testifying talks about efforts to combat this, fraud detection systems, partnerships with local organizations, hotlines for reporting scams. And look, that's good. That's necessary. But let's be honest here. If we're already at the point where billions are being stolen, then something deeper is broken. Because prevention should come before cleanup. The representative makes a point that I think resonates with a lot of everyday Americans. He says, look, this isn't complicated. Follow the data. Look at where the money is going. Identify the states with the highest spending, the highest fraud rates, and focus enforcement there. That's common sense. And yet, what we hear in response is a system that's trying to manage a massive problem after the fact instead of stopping it before it starts. Then we get into another critical point, how some states are spending far more than others. For example, Medicaid spending in New York is reportedly 36% higher than the national average. Now that raises serious questions. Why is that happening? Is it legitimate need, or is it inefficiency, waste, or outright fraud? And even more concerning, there are examples given of fraudulent schemes involving adult daycare centers and autism services, where money is being funneled through fake claims, and even kickbacks are allegedly being paid just to bring in patients for services that were never provided. This is not just corruption. This is exploitation of trust. Programs like Medicare and Medicaid were created to protect the most vulnerable Americans, the elderly, the sick, those who truly need help. And what we're seeing here is those very programs being turned into targets by bad actors who see them as easy money. And let me say this clearly. When government systems become this large, this complex, and this loosely monitored, they become vulnerable. That's not an accident. That's a consequence. Because the bigger the system, the harder it is to control, and the easier it becomes for people to slip through the cracks. Now, I'm not saying these programs shouldn't exist. They serve a purpose. But what I'm saying is this. If you're going to take taxpayer money, you better protect it. If you're going to promise care to the elderly, you better make sure that care is real, not just a line on a fraudulent invoice. Because right now, what this hearing shows is a system where fraudsters are getting rich while honest citizens are left dealing with the consequences. And that's unacceptable. The official even admits there's not just fraud, but also waste and abuse. People billing for higher-level services than necessary or charging for things that were never needed in the first place. That's money being drained out of the system every single day. And who pays for it? The taxpayer. The working American who follows the rules, pays their taxes, and expects those dollars to actually help people, not line the pockets of scammers. At the end of the day, this hearing wasn't just about numbers. It was about responsibility. It was about whether the government can actually protect the systems it runs. It was about whether leaders are willing to take real action instead of just acknowledging the problem. Because identifying fraud is not enough. Talking about fraud is not enough. There has to be accountability. There has to be consequences. And there has to be reform. Otherwise, this continues. And here on Freedom Forge, we're going to keep shining a light on it. Because if we don't demand better, nothing changes. If you want more real, no-nonsense breakdowns like this, make sure you like this video and subscribe to Freedom Forge. Because the truth doesn't defend itself. We have to stand up and speak it. And I'll see you in the next one.